Welcome to this session on advanced clinical pathophysiology. By the end of this lesson, you will be able to define clinical pathophysiology and state how it supports advanced nursing and midwifery decisions. You will also learn to differentiate between normal and abnormal body function using clear examples, and identify how diseases begin, progress, and lead to complications. Let's begin with the first concept. What is clinical pathophysiology? Clinical pathophysiology is the study of how disease processes disrupt normal body function, and how these disruptions lead to patient deterioration if not identified and managed early. In simple terms, physiology explains how the body works under normal conditions, while pathophysiology explains what happens when those normal processes are disturbed by disease, injury, or stress. For advanced practice nurses and midwives, this knowledge is not just theoretical. It directly guides you to assess risk, make escalation decisions, anticipate complications, and protect patient safety. Let's look at an example. Reduced cardiac output does not only result in fatigue, it initiates a cascade of events including reduced organ perfusion, compensatory tachycardia, neurohormonal activation, and eventual organ dysfunction. Recognizing this sequence enables clinicians to intervene before irreversible damage occurs. Now that we have seen what clinical pathophysiology means, let's move to the next concept. What is normal and abnormal function? Normal function is the body operating within stable limits that support survival, such like oxygen delivery, blood pressure, temperature control, and fluid balance. Abnormal function occurs when disease disrupts these processes and pushes the body away from stability. A simple way to assess this is to ask, is the body maintaining stability easily, or is it struggling and using extra effort to stay stable? Now, let's see some clear examples in normal and abnormal function. In normal conditions, the lungs exchange oxygen efficiently without distress. In abnormal conditions, fluid in the lungs interferes with gas exchange, leading to shortness of breath. Similarly, normal kidney function maintains fluid and electrolyte balance. But when this regulation is impaired, it results in fluid imbalance and widespread systemic effects. This perspective is important. It helps you stop seeing symptoms as isolated issues and start recognizing them as signs of underlying physiological disturbance. Let's explore how diseases start and worsen. Most diseases follow a predictable pattern. First, there is a trigger, such as infection, injury, inflammation, or reduced blood supply. Next comes early disruption, where subtle physiological changes begin. The body then enters a compensation phase, activating mechanisms to maintain stability. If it is not managed, this results in complications, including organ dysfunction and secondary damage. Problem persists, the condition progresses, affecting multiple systems. Eventually, decompensation occurs when the body can no longer cope, leading to rapid deterioration. If not managed, this results in complications, including organ dysfunction and secondary damage. This is why early recognition is critical. The best time to intervene is during the early stages, before the body's compensatory mechanisms fail. That is it for now. We shall continue this section in the next video. But before then, let's summarize the lesson. Clinical pathophysiology provides the foundation for understanding patient deterioration, guides clinical reasoning, and improves patient outcomes. We have come to the end of this session. Thanks for watching. See you in the next session.